a group of videos and documents intended to guide you during these uncertain times. This video will provide you with guidance on what to do if multiple family members are sick with COVID-19 and when a child should stay home from school and/or childcare. This video and the accompanying documents were produced by the Central Shenandoah Health District. This is an outline of the presentation today. First, we're going to talk about some important definitions, then how to protect household members from COVID-19, and how to care for a sick household member, what to do if you are asked to quarantine. We'll go through a few different quarantine scenarios, and then we'll talk about some general guidance for sending children to school. First, it's important to talk about some words that have been used throughout this pandemic. We'll start with quarantine. Quarantine is the separation of a person who has been exposed to an infectious disease from others, even though that person doesn't have any signs or symptoms of the disease. The time from when a person is exposed to the virus that causes COVID-19 to the time when symptoms first appear can be up to 14 days. So a person who has been exposed to someone with COVID-19 needs to stay in quarantine for 14 days to be sure no symptoms develop, even if they have a negative test for COVID-19. Next, we have isolation. Isolation is the separation of a person who is sick with an infectious disease from others. A person who has COVID-19 can potentially spread it to others for 10 days after symptoms begin. So a person with the disease needs to stay away from others, that is, to be in isolation, for 10 days to ensure not to spread it to anyone else. Even after 10 days, a person cannot stop being in isolation until at least 24 hours have passed since their last fever without using fever-reducing medicine, and all other symptoms have improved. Lastly, we have close contact. Close contact means being within 6 feet of someone with COVID-19 for a total of 15 minutes or more over a 24-hour period, or having exposure to the person's respiratory secretions, for example, being coughed on or sneezed on, sharing a drink or glass, or kissing. This definition was updated in mid-October 2020. All right, so now we're going to talk about how to protect your household members from COVID-19. It's important to reiterate prevention measures that your household members can take, such as stay home as much as possible. While this might be difficult, it's important to continue only make essential trips like getting groceries and medicines, going to work, going to school, and other things like that. Wash your hands often, especially after you've been in a public space or after blowing your nose, coughing, or sneezing. Use an alcohol-based hand sanitizer that contains at least 60% alcohol if you cannot wash your hands with soap and water. Don't touch your eyes, nose, and/or mouth with unwashed hands. Cover your coughs and sneezes, clean and disinfect your home, and don't have visitors unless they need to be in your home. It is also important to take steps to protect children from getting sick and to help them understand the importance of preventative actions. Here are some things you can do to protect children and help educate them on the importance of these actions. Teach children about the steps they should take to stay healthy, like washing their hands, covering their coughs and sneezes, and other things like that. Don't let children have in-person playdates with children from other households. Teach children who are playing outside to stay 6 feet away from anyone who is not in their household, and help children stay connected to their friends through video chats and phone calls. If a member of your household is sick, they will need to isolate. During this time, it is important to give them the care that they need without potentially exposing other members of your household. If they have symptoms of COVID-19 or tested positive for COVID-19 and have symptoms, their isolation can end after at least 10 days have passed since their symptoms appeared, 24 hours have passed with no fever, and then other symptoms are improving. If they tested positive for COVID-19 but have no symptoms, isolation can end 10 days after their COVID-19 test date. In cases of severe illness from COVID-19, like admission to the hospital and needing oxygen, healthcare providers may recommend that isolation extends for longer than 10 days after symptoms first appeared, possibly up to 20 days, and that isolation might need to finish at home. All right, so during their isolation period, it's important that they limit their contact with other household members as much as possible. If you are caring for someone who is sick, here are some tips. Have the person stay in one room, away from other people, including yourself, as much as possible. Have them use a separate bathroom if possible. Look for emergency warning signs of COVID-19. If someone is showing any of these following signs, you should seek medical care for them immediately. These include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, or bluish lips or face. Make sure that the person with COVID-19 drinks a lot of fluids to stay hydrated, rests at home, uses over-the-counter medicines to help with symptoms, and then you should have their doctor's phone number on hand and call if the person with COVID-19 gets sicker, and then for any medical emergencies, call 911 immediately and tell the operator that the person you were calling for either has COVID-19 or is suspected to have COVID-19. So, space might be limited in your household, and it might be hard for the person with COVID-19 to isolate completely. Here are some tips that you should do if space is limited in your household. Make sure that everyone stays 6 feet apart. Have the sick household member wear a mask when they're around other people in the home. Separate as much as possible. Designate one caretaker for the person with COVID-19, and the caregiver should be someone who is not at higher risk for severe illness. The caregiver should clean where the sick person has been, including all of their laundry. The caregiver should minimize contact with other people in the household, especially those who are at higher risk for severe illness. And the caregiver have a caregiver for the person who is sick, and then a different caregiver for other household members. Clean and disinfect high-touch surfaces like doorknobs, bathrooms, other commonly touched surfaces. Limit visitors to the home. Don't share personal items like phones, dishes, bedding. Have the person who is sick clean and disinfect frequently touched surfaces in the shared bathroom. If you need to share a bathroom with the person who is sick, if you need to share a bedroom with someone who is sick, try to do the following. Make sure the room has good airflow. You can help this by opening a window or turning on a fan. Place the beds at least 6 feet apart if possible. Sleep head to toe. And then you can even put a curtain around or place another physical divider to separate the bed of the person who is sick from other beds in that room. Alrighty, so if you're asked to quarantine, you should stay home for 14 days after your last contact with the person who has COVID-19. This means don't go to work, don't take public transportation. If possible, stay away from others, especially those who are at higher risk. Watch for a fever, cough, shortness of breath, and any other symptom of COVID-19. And it's important to note that you cannot test out of quarantine. If you tested negative in the middle of your 14-day quarantine, you still need to complete the full 14-day quarantine. This is because it can take up to 14 days after exposure to the virus that causes COVID-19 to become sick. Next, we're going to discuss a few different quarantine scenarios. So, as we discussed above, if a member of your household has COVID-19, one of the most important things the rest of the household members can do is limit their contact to the sick household member. This is because the 14-day quarantine period depends on the last day of contact with the sick household member. If the household member continues to have close contact with that person, then their quarantine period will start over. We'll discuss a few different quarantine scenarios below. These situations apply to all household members, but we have used children in the examples. So in this first example, your child had close contact with someone who has COVID-19 and will not have further contact. So this would apply to maybe your child got exposed at school or somewhere outside the household. In this scenario, your child would follow the 14-day quarantine guidance. They should stay home for 14 days and monitor their symptoms. Their last day of quarantine is 14 days from the date they last had close contact. If they have not developed symptoms, they can return to school or childcare on day 15. Alrighty. In this next scenario, it's a little complicated. So, you may want to view the supplemental document to follow along. So in this example, your child is under quarantine and had additional close contact with somebody else. So for example, there are 3 members in your household, 2 adults and 1 child. On day 1, dad tests positive for COVID-19 and begins isolating. The 2 other members of the household begin their quarantine. On day 5, mom develops symptoms and tests positive for COVID-19. Since mom needs to continue to be in contact with the child's 14-day quarantine period begins after mom's isolation period ends. On day 16, mom has met the requirements to end isolation. This means on day 31, the child has completed their quarantine period and can return to school. Some key points. Anytime a new household member gets sick with COVID-19, your child and/or other household members that had close contact with them will need to restart their quarantine. Quarantine needs to happen while family members are isolating, so they happen kind of concurrently. The 14-day quarantine countdown for household members who do not develop symptoms and/or test positive for COVID-19 starts when the last sick member completes their isolation. And this is because it can take up to 14 days after exposure to the virus that causes COVID-19 to become sick. Again, there's more information in the supplemental document that may be helpful. Next, we have a simple flow chart for you to follow. These do not account for multiple household members being sick with COVID-19, but are good baseline scenarios for determining when your child can return to school or childcare. Please refer to the scenarios presented before this slide if your child is living with someone who is sick with COVID-19. So before you send your child to school or childcare, you should ask yourself 2 questions daily. Has your child had close contact with someone who has COVID-19 in the last 14 days? And is your child sick? If the answer is no to both these questions, then your child can go to school or childcare. If the answer is yes to either of these questions, then the child should be kept home. The decision tree shows a simplified version on how to decide what you should do if you answered yes to either of those questions. You should always consult with your healthcare provider if you have any questions or if your child is sick. In the supplemental document, there is more information about these 3 scenarios. So that concludes today's presentation. Links to everything discussed today can be found in the accompanying document. If you have any questions about the content presented today or any other COVID-19 questions, you can email us at cshdinfo@bdh.virginia.gov or visit the Virginia Department of Health website. Thank you for your time.